All right. Good morning, everyone. We are going to go ahead and get started today. Thank you so much for joining our Alaska Women's Wellness mini series. This is our session 1, Reducing Women's Barrier to Care at Your Clinic. Our first session is today, and then our next session is exactly 1 week from today. And we thank you for joining. Next slide, Jeff. All right, so just a few housekeeping items. Everyone will be muted during the session, but please feel free to put any questions in chat. We'll either be able to jump to them during the presentation or we'll get to them at the end for question and answers. And we also do have a few polling questions for everyone, so feel free to kind of chime in during those. Also, we're going to be mindful of everyone's time. We know everyone is exceptionally busy and wearing very many hats these days. So we will probably not take the full hour, and we will get through all this content today, and we hope that you have some great takeaways. Next slide. So today's agenda, we're really going to have an overview of why good and timely primary care is important for women, identify barriers to care and challenges unique to women, identify strategies to apply with hard to reach women that improve cervical cancer screenings and wellness visit attendance rates. Next slide. And today's presenters is myself. I'm Erin Ackelstead. I'm with Mountain Pacific Quality Health. And we also have Jeff Redikopp with Quality Health Associates of North Dakota. And we're so happy to have him with us today and all of his expertise. And I am going to turn it over to him.
Thanks, Erin. So we're going to start out today's session with a little bit of a data review. According to the most recent data available, cervical cancer screening rates and women's wellness visit attendance rates are at the percentage that you see here on the screen. If we look at the comparison to other states, Alaska ranks 25th in cervical cancer screening. And if we do a little bit more of a deeper dive, I'm going to reference population trends in the state for the most recent snapshot of data, which is from calendar year 2018. And according to this breakdown, women ages 25 through 34 have slightly higher screening rates at 84.5% versus 80.9% for women ages 35 to 44. Alaska Native women have seen a sharp increase in screening rates between 2014 and 2018, which is good. And these were at 88.4% as of 2018, compared to white women who were at 79.5%. Educational level has a definite impact here on these data, with women who were college graduates or having attended some college at 88.7%, with high school graduates dropping down to 75.4%. The income metric is a little bit harder to track because the most recent data we have is from 2016. And at that time, income rates of less than $25,000 per year had the highest screening rates at 92.1%, followed by income rates of $75,000 or more per year at 84.6%. Income levels at $25,000 to $50,000 per year were at 82.6%, and income levels $50,000 to $75,000 per year had the lowest screening rates, which were at 64.6%. Screening rates for women ages 35 to 44, white women, and high school graduates all were below the national average in each of these respective categories. We'll start out with some good news here. Well woman visits increased from 52.7% to 71% in women ages 18 to 44 between 2016 and 2018. And if you look at the comparison for the 2021 rates, Alaska rates 38th out of the 50 states. And if we dig into that a little bit further and break it down by the same categories as we just did with cervical cancer screenings by population trends, The data shows that in 2018, women aged 18 to 24 had the highest well woman attendance rate at 72.2%, followed by those aged 25 to 34 at 71%, and then ages 35 to 44 were at 70.2%. And according to the race and ethnicity data that's available, Alaska Native women had the highest attendance rates at 79.6%, followed by women of multiracial background at 75.9%, and then white women at 66.4%. As far as educational rate, the trends we see here are similar to what we just looked at with cervical cancer screening. Women with some college education were at 77%, followed by college graduates at 71.4%, and high school graduates at 68.4%. And as far as income level, those women with the highest income levels at over $75,000 a year had the highest attendance rates at 76.4%, followed by those in the $25,000 to $50,000 a year category at 74.2%, then the $50,000 to $75,000 category at 69.8%, and at last, the individuals who were making less than $25,000 a year were at 59.6%. So we're going to start out here with a polling question just to get a little bit of an idea of what your patients are sharing with you. Our question here is, what are the biggest barriers your patients report for not coming in to have a well woman visit or a cervical cancer screening? So please just go ahead and take the next minute or so to share your thoughts and answers with us. And again, you've got several answers to choose from here. If you do choose the other category, please go ahead and just chat your answer in. And Aaron, if you wouldn't mind sharing that, whatever the chat shows there. All right, well, so far it looks like most people are hearing that the patient doesn't think they need the visit or the screening. It looks like there's a little bit of a language communication or understanding barrier as well. I'll give you all just a few more seconds here. All right, let's go ahead and show the results, please. Okay, so the results were basically what we just saw on the screen here. The majority of folks are hearing from their patients that they don't think they need the visit or screening, with language kind of a distant second as a barrier. Aaron, what are some of the things that you're hearing from the practices that you're working with?
Yeah, I think some of the challenges over the past, 2 years really have been kind of COVID concerns, and also getting women like back into the office after maybe not going in for the past 2 years. So those are some of the other barriers that are kind of more obvious over the kind of current time frame.
And that's definitely understandable, because I think we're seeing a lot of that same type of situation in most of our states. All right, we'll close this poll out. Women have unique health needs from puberty through advanced age and require care to bridge their individual life transitions. According to studies conducted by the International Council on Women's Health Issues, when a woman who is a mother dies, her children, family, and friends experience downturns in education, health, and economic outcomes. Comprehensive primary health care is vital for helping women improve their health outcomes and promote health equity. As women age, they have need of a primary care provider who can monitor their evolving needs, provide coordination across specialty services, and understand patterns that can indicate potential for future health risks. When women receive good primary care, it advances the health and economic well-being of the whole population. The healthcare system can often be unfriendly to women. Women who are part of ethnic minorities or in underserved populations seem to be the most affected. According to the research by the Commonwealth Fund in 2020, there are 3 separate categories to define the barriers women experience when seeking and receiving appropriate healthcare. The first category has to do with education, financing, and policy. And unfortunately, much of our healthcare system's historical medical research is centered on men, and thus doesn't take into consideration women's physiological differences. And additionally, key leadership roles with the opportunity to affect positive change have only recently begun to be filled by women. The second category addresses how care is delivered within that primary care system. And unlike their male counterparts, women face unique challenges because of the roles they fill within their families and the delicate balancing act they face between careers and home life. Women's distinct health-related social needs can often be overlooked by the healthcare system. Care coordination is also more vital because of the physiologic changes they experience over the course of their lives. Siloed care due to health transitions over the course of life, lack of available or qualified women's health specialists, and confidentiality and stigma are also significant obstacles that women encounter. The final category that the Commonwealth Report explores is within the area of primary health care utilization. For many women, access is a huge problem, especially in underserved regions. It can be particularly hard for working women to receive care if employers don't allow flexibility to attend appointments during normal working hours. Accurate communication can be a substantial challenge for some women facing translation barriers if English is not their primary language. So it's important to understand your community population to ensure no patients slip through the cracks. And keep in mind too that any educational material that your clinic provides needs to be written at a 5th grade level because there are many more people with a difficulty in health literacy understanding than many of us as healthcare professionals truly realize. Many clinics lack capacity to offer appointments outside of regular business hours. Women are also much more likely to skip appointments due to cost and have greater concerns about losing insurance coverage or coverage costs increasing because of pre-existing conditions. One of the other factors that we haven't mentioned yet is that women also have a higher prevalence of unemployment compared to men. For women, it's important to think about the advantages of having a primary care provider, some of which are staying healthier, saving time for care, receiving competent and consistent guidance through the healthcare system, and having a trusted healthcare advocate and advisor. Prevention and wellness services help to protect and improve health for women by using early detection and periodic reassessment to help promote healthy behaviors that can help have a positive effect on preventing future disease or helping to positively affect progression of chronic disease states. A proactive approach at the primary care level also helps control costs of care. These preventative screenings and services can all be performed at the primary care level. For the purpose of this series, we're going to be focusing on women's wellness visits and cervical cancer screenings. The Well Woman visit provides an excellent opportunity to counsel patients about maintaining a healthy lifestyle and minimizing health risks. Current national guidelines state that each woman should have at least one Well Woman visit per year, with the option for more than one when necessary. Most insurance plans do allow one of these visits annually. And these visits can also include areas such as pre-pregnancy, prenatal, postpartum, and interpregnancy. Visits can also include assessments of physical and psychological function and any type of screenings related to age, current health, and risk factor profile, as well as any necessary immunizations or beneficial counseling. A team-based care approach is a best practice to ensure efficient coordination and delivery of needed services. Typically, these visits should start at age 21. The main idea behind cervical cancer screening is disease prevention. According to the American College of Gynecologists and Obstetricians, it usually takes from 3 to 7 years for high-grade changes in cervical cells to become cancerous. Women with low-grade changes can be tested more frequently to see if their cells go back to normal. Women with high-grade changes can get treatment to have the cells removed. Regular screening provides the best opportunity to find these changes early and start treatment when it can be successful. And over the last 30 years, screenings have reduced the death rate from this disease by 50%. The American Cancer Society reports that most cervical cancers are found in women who've never had a Pap test or who haven't had one recently. Employer sick leave and personal time policies can be inflexible, which limits women's ability to seek regularly scheduled care opportunities. The United States has the most complicated healthcare system in the world, and often insured women, even those with high education levels, can benefit from having a well-versed professional help them understand their coverage and navigate the maze so they can make wise choices. Some states have communities where stakeholders are coming together to develop scholarship funds for women who lack insurance coverage. Explore how to partner with your peers in your community to develop a mechanism to allow women to review providers and recommend women-friendly sites. The Well Woman Project, Listening to Women's Voices, which was published in the Journal of Health Equity in 2018, outlines several strategies identified by women that could help attendance rates at Well Woman visits. Improving access was a primary recommendation. Because of competing responsibilities and priorities, it's more difficult for women to attend appointments during normal business hours. Offering a few consistent early morning, late evening, or even weekend appointment slots could help address that obstacle. Blocking a certain number of weekly appointment slots dedicated for Well Woman visits only could also increase attendance. Encouraging the use of and expanding access to the patient portal can help some women engage in important discussions with their provider and get answers to the questions they have on a timely basis. Working with other organizations in your town to develop a women's hotline could be a great way to offer women a free resource that can provide current information on healthcare recommendations and guidelines. Help women understand how to advocate for their care by making available easy to comprehend materials. Self-advocacy may require some women to break free of ingrained family cultural norms, such as breaking free of a patriarchal culture. Sometimes women don't know if certain clinics or practices have providers certified or licensed for women's health services, which may give the impression that the community is underserved when it actually has skilled and experienced providers available to see them. Sometimes women are just uncomfortable or fearful of attending appointments. Fear of the unknown, sometimes it's fear of results, especially if she's been experiencing symptoms. A health peer advocate can attend the appointment with the patient and offer emotional support. And especially if your community has community healthcare workers, this would be a great gap for them to fill. They can be used to provide community and/or direct patient outreach and follow-up, as well as basic patient education. Some women miss their visits simply because they don't have the transportation to get to and from them. Ensuring they have a ride could help increase your clinic's well woman visits significantly. And if you aren't currently screening for social determinants of health, this is really a great opportunity to implement this into your workflow, because the tool that you use will be able to help you uncover who's having transportation or other issues, and also help give you the chance to come up with a plan to be able to address that issue. Discounted bus or train cards could also be an option here. Have someone in your clinic contact the Department of Transportation to see what they offer in the way of women-friendly public transportation. The state of Minnesota has developed a quality improvement toolkit for improving cervical cancer screening rates. The document lays out 4 evidence-based essential action steps that can help practices improve screening rates. These 4 essentials are listed on the slide. One of the most interesting comments the tool notes within Essential 1 is that the primary reason women say that they aren't screened is that the physician didn't advise it. The physician's recommendation remains the most important factor in a patient's decision to take action. For Essential 2, having a standard action plan will ensure all team members understand what needs to be done. Essential 3 may be the most important component from the patient perspective. Persistence does pay off. With Essential 4, as with any quality improvement project, it's important to establish a baseline and collect and utilize data. This document is quite comprehensive and practical, and I've included it in the resource slide that you're going to be able to have access to at the end of this presentation. We'll dig into Essential 2, developing a cervical cancer screening policy here. The first process step your practice will want to take is to design a standard course of action. Make sure it's documented and shared with all of your practice personnel. Build a list of resources for screening in your community and determine capacity. Your next step will be to create a tracking and follow-up program. Please take a look at the State of Minnesota ICC screening toolkit listed on the slide. And again, this is part of the document that I just referenced that will be on your resource slide at the end of the presentation. This document lists out sample colorectal cancer screening algorithms, but these can also be modified to fit cervical cancer screening. Several studies have shown individual outreach to women to be highly successful. Research conducted by the American Academy of Family Practice demonstrated that a personal invitation letter to come in for screening was the most effective intervention listed above. However, not everyone responds to snail mail. Younger women may respond better to phone calls by someone they have a positive connection with at the practice, or to text messages. Group education, depending on your team's capacity, is also an option when women are due to come in for other preventative services. Consider providing an educational video if face-to-face education isn't time efficient. One other method not mentioned here is email. If your clinic has a social media presence like Facebook, have one of your super users add some scripted content about the importance of getting screened. Providers, ask your ladies with barriers to attending appointments what their preferred method of receiving important communications from your clinic is, and then use that medium with those ladies. Evidence gathered by the American College of Gynecology and Obstetrics demonstrated that women responded best to multiple methods of invitation, not just one. Remember to be persistent with reminders. One key piece here is that our slide doesn't mention is using the annual wellness visit to conduct cervical cancer screening. For those women who are Medicare beneficiaries, this appointment is a perfect opportunity to complete a preventative care screening. One other idea here is to make sure that you're mentioning the importance of cervical cancer screening and well woman visits when your patients come in for other visits, regardless of whatever that reason is. Outreach from someone in the community familiar to them can be an effective strategy for women who face health disparities or come from an underserved population. Public service announcements over TV and radio from a trusted community member emphasizing the importance of screening are another option. Consider reaching out to companies in your area and teaming up to promote the importance of screening to women while they're in the workplace setting. Work with them to develop employee health incentives for screening. Another opportunity is partnering with local women's health specialists to provide free screenings for uninsured women. Consider partnering with your local health department to make sure all women have access to screening. One other possibility here is getting community involvement to develop links to referral sites and screening centers so there can be follow-up for those women who do have abnormal tests. Having a collaborative relationship with your patients will help them become active participants in their care. The self-management steps listed here will help empower women to take steps that will place them in charge of their own health. Promoting team-based care within your location will allow your team members, like your MAs and your nurses, to work to the top of their license, which can spread the workload and remove tasks from the provider's plate that can be performed by others. This workload shift may even increase patient capacity within the schedule. Comfort and privacy are vitally important to women for these exams. Ask for patient feedback to find out how you can optimize conditions at your location. And I'm going to pass it back over to Erin, and she's going to talk about a few community linkages.
Yeah, thank you, Jeff. So really understanding your community population and how do you address those barriers? How do we increase preventative cancer screenings? How do we increase women's wellness visits? As Jeff noted in one of the first few slides, Alaska is doing really well in getting women in. It'll be interesting to see kind of what the rates are for the past 2 years. And, just from what we've been hearing are the, how are we getting the women back in? We need to try maybe other strategies to get women to find that importance to get back in the office. And it was also identified in the polling is that, women don't think that they need it. So who can we lean on to kind of help us be advocates in the community? So looking at our community partners, they can help us address barriers. They can help, financially support women, provide education, advocacy, patient navigation. So Ladies First, as an example, they have folks in different areas across Alaska that actually help with the navigation piece, help address barriers. So we really could use these community partners and these community linkages to lean on them to help us get these women in for preventative cancer screenings and annual wellness visits, and just continuing getting the word out, letting women hear it over and over and over and over. So it's important to know what is in your community, what is available for the population you serve, and just really kind of understanding the resources in your community so you can pool them together to bring them in to help you and your patients in your community. And another example that I have too is there's these examples from kind of all across Alaska. So Ladies First, it's a statewide program. Search, we have Alaska Native Tribal Health Consortium. Let Every Woman Know is more of like advocacy, education. The Arctic Slope Native Association screening for life services. And there's also other programs out there that you may not even have thought about is, for an example, in the Matsu Borough area, there's Matsu Connect, and they have a whole list of resources for patients that could help with transportation, language services, just an array of resources that could help patients kind of overcome these barriers that they might be seeing. So it's really important to know what you have out there in your community, what you can lean on. You don't have to do this on your own. There are tons of services, resources available to you. So it's important to kind of lean on those. And next slide. And here's our next polling question. And this is really kind of like our wrap up. And like I said, we weren't going to take up, our full hour today. This is really setting us up for our data discussion next week. So one of the things that we're interested in hearing about from the community or from you all from joining is if you would be interested in working on a quality improvement project to improve outcomes for Alaska women. So are you interested in strategizing your social determinants of health, your women's wellness visits, preventative cancer screening, kind of looking at your community resources, like how can we work with you to look at your community resources and how can you utilize them to support your practice goals? Also thinking of simple things like reminders. So not even just the canned reminders. I think we're needing to be more crafted and more meaningful in our outreach campaigns and reminders. So just some of those activities that we kind of talked about today is like all the things we talked about is, breaking those down. So what is something that you could focus on in your practice that maybe could help increase preventative cancer screenings, increase women's wellness visits? And again, this is just really setting us up for that data discussion next week and kind of getting into the nitty gritty of how we can utilize our data to help also achieve some of these objectives that we talked about today. So yeah, so thank you. So I'll be following up with everyone who was able to kind of note on the poll today. So we appreciate that. And we can stop sharing and kind of keep moving on. Yeah, and if we'll just give everyone a minute or so to note if there are any questions, if there's any questions in the chat, please feel free to put them in. And if not, we'll just give everyone a second to put anything in the chat and we could just go to the next slide and we'll just keep monitoring the chat. So here are the resources available. We'll send it out to everyone who registered for the webinar today. Again, Jeff had noted there's a lot of really great resources out there and toolkits that are out there available. So again, this is just kind of bringing this women's wellness and preventative cancer screening kind of up to the forefront of our minds again. If we've been in COVID for a couple of years now, how do we get women back in to our clinics? How do we make this meaningful to them? And maybe it is going back and looking at our education or, kind of our outreach patient material, making that 5th grade level, having more targeted outreach campaigns to talk to certain groups of, your patient population. And next slide. And again, next week, we're going to be talking about using data. So how do we really strategize and look at our data to make it meaningful? How do we look in those gaps in care? How do we find those women who are falling through the cracks possibly? Again, Alaska is doing really well, but there's always women, that group that we could still target and put some focus around. So we'll be talking about social determinants of health, team-based care, EHR functionality. We're going to touch on risk stratification and a few other topics related strictly to data. So we really hope that you're able to join us. And yeah, we'll stick around for a little bit if anyone has any comments or questions, and we hope to see you next week.
And again, feel free to go ahead and put your comments in the chat, and we will go ahead and address those as they come in. And one thing I'll mention, just to circle back to a couple of things, couple of points in the presentation, it's that health literacy is really a huge issue all across every state. And I can say from working in hospital-based patient-facing care for 23 years in 3 different states, Montana, Hawaii, and North Dakota, I didn't realize how many patients I worked with had health literacy issues. And so that's something to really keep in the forefront of your mind. And any of you that may have had the opportunity to be on the presentation that Dr. Barry Weiss gave several days ago on health literacy, he really gave some great examples of how we can change our communications and change our materials that we're producing to be able to put them in a format that everyone can easily understand.
Yeah, thanks, Jeff. Well, I think, Maynette, I think we're good to close it out.
Thanks, everybody.